All right, so welcome to the final presentation, or let me say episode of Krok 2 2020 booklet. Krok 2 2020 booklet. And I believe by now you have learned a lot of things. All right, so let's finish it up and then let's do something else. All right, so let's begin. A 32-year-old woman complains of general weakness, low-grade fever persisting for 4 good months, lumbar pain, and dysuria. Anamnesis includes frequent acute respiratory diseases, overexposure to cold, low-calorie diet, a case of pulmonary tuberculosis in childhood. So we're having all these presentations, and again, they've given you a history of tuberculosis. So then again, what comes to your mind is you need to be looking at some few complications, perhaps, that will be relating to what? To tuberculosis or even respiratory diseases. Because they say analysis even include frequent acute respiratory diseases. So that means this person has been getting infections very often. And in addition to it, there is a case of what? TB. Now, clinical urine analysis shows a pH of 4.8, leukocyturia, hematuria, complete blood count. We have leukocytosis, lymphocytosis, increased ESR. Urography includes dilatation of the renal pelvis and the callaceous system of both kidneys. So you ask yourself, the renal pelvis, the calyxes, or the callaceous system, they are all distended or they are dilated. That means there is accumulation of fluid inside these areas. And they're saying there's a foci of calcification in the projection of the right kidney parenchyma. What is the likely diagnosis? So even from the urography, you could tell that there could be a case, or this could be a case of what? Of hydronephrosis, isn't it? Hydronephrosis. You could have been thinking of that. Why? Because there is a distension of the renal calyces and the renal pelvis. That's because there's accumulation of fluid inside these areas due to a blockage in the outflow, or obstruction of the outflow, and of course that is distal to the renal pelvis. However, we having a history of tuberculosis, definitely we are looking at what? Nephrotuberculosis. So C will be our best answer in this case. An unconscious patient was delivered to a hospital by an ambulance. Objectively, his body temperature is 39. He presents with convulsions and red, dry skin. I think a few days ago, we posted a video on convulsion on medent_edu. That's on Instagram. Please do well to go and look at how convulsion is, or have a glimpse of what convulsion is all about if you've not seen somebody convulsing before. All right. Now, it is known that the patient works as a stoker in the boiler room. What is the likely diagnosis? So, for a person who works as a stoker in the boiler room, you could be looking at a possible heat stroke as to be the cause. Heat stroke should be suspected. And heat stroke is simply a condition that is marked by high fever and often accompanied with unconsciousness. And again, this is because it results as a result of, or as a failure of, the body's temperature regulating mechanism. They are faulty, or there's a failure in its mechanism when the body is exposed to excessively high temperatures. So when your body is exposed to high temperature, and in this case, in the boiler room, which has too much heat, your thermostat or your thermoregulation should be able to, in a way, adapt to it in a way that it can protect you and prevent unconsciousness and, of course, too much of what fever. So, due to the inability of this thermostat or this temperature regulating mechanism to protect you, this person, to protect the person, we can call this, or we can give a provisional diagnosis as a heat stroke. Heat stroke. And so, therefore, we will look at A as our answer, heat stroke. All right. A child was born at 40 weeks of gestation with the weight of 3,700 grams. The APGAR score is 7/9. The body was put to rest. The baby was put to breast immediately after birth and sucked actively. Okay. On the third day of life, the child's weight decreased to 3,600 grams. So from 3,700, now we have what? 3,600 grams. The question now is, what transitory condition is observed in this child? Now, it is worth knowing that exclusive breastfed newborns, exclusive, that means just being fed with breast milk. These people are normally, exclusive breastfed newborns typically lose as much as 10% or more of their birth weight before beginning to gain weight in the first days after birth. That's according to the studies that I was able to find out. I found out that after giving birth, many lose their body weight until, they lose their body weight, but they regain it back later on. They will gain it back. Okay, so they lose about 10% or even more. Some can even lose more than 10% of the normal body weight that they came with. Okay, and normally by 48 hours, almost 5% of babies born vaginally and 10% of those born by cesarean delivery lose at least 10% of their birth weight. 48 hours. Just 48 hours after birth. 48 hours after birth. And then by 72 hours, 25% of cesarean delivery infants lose at least 10% of their birth weight. 10% of their birth weight. So if you look at what we are having over here, from the presentation that we are having over here, calculating, that means subtracting 360 from 3,700, we could estimate about 2.7% of weight loss. 2.7% of weight loss, which, of course, should be normal. So over here, we will be looking at what? At a normal weight loss or physiological weight loss. 2 hours after eating unknown mushroom, a 28-year-old man sensed a decrease in his mobility and deterioration of his ability to focus. This condition was then followed by a state of agitation and aggression. On examination, he is disoriented and his speech is illegible. So now this is telling you of what? CNS manifestations. Now, 4 hours later, he developed again CNS manifestation, but look at it. The person developed what? Fetal hepaticus, and lost his consciousness. What syndrome can be observed in this patient? And I believe you know what fetal hepaticus is all about because we have discussed it before. And this is simply, another name for it is called the breath of the dead. I don't know why they call it the breath of the dead, but basically it is a condition that is seen in a portal hypertension where there is when the portosystemic shunting allows thiols Thios to pass directly into the lungs. Thios, Thiol. Thios, they pass directly into the lungs, and it is a sign, a late sign of liver failure. It is a late sign of liver failure. And again, so this, of course, over here, we will be looking at what? At a liver failure. Liver failure. Liver failure. And that's over here. Your answer should be what? E. Acute hepatic failure or acute liver failure. All right. A 17-year-old girl complains of pain in her knee and ankle joints and body temperature up to 39 degrees Celsius. 2 weeks ago, he had a case of acute tonsillitis. So they're giving you acute tonsillitis. Good. Objectively, her joints are swollen. Objectively, her joints are swollen, sharply painful, and their mobility is reduced. Their mobility is reduced. On the skin of her trunk and in the limbs, there are barely visible circled shaped pale pink spots. Heart rate is 95 per minute. Blood pressure is 90/60. Heart sounds are weakened. There is a soft systolic noise over the apex. What is your provisional diagnosis? Again, they've given you a history of what? Acute tonsillitis. 2 weeks ago, acute tonsillitis. And we have already discussed some of these things. So over here, you are definitely diagnosing this as an acute rheumatic fever. Acute rheumatic fever. No two ways about that. No two ways about that. All right. A 19-year-old girl complains of moderate itching and their loss on her head. Objectively, on the skin of her occipital region, there is a single round erythematous focus, 3 centimeters in diameter, with clear margins. Asbestos-like scales can be observed on the surface of the lesion. The hair in the focus of the lesion is broken off at the length of 6 to 8 millimeters. What is the most likely diagnosis? What is the most likely diagnosis? And of course, we are going to diagnose this as pityriasis amiantaceae. Pityriasis amiantaceae. Pityriasis, P-I, pityriasis, R-I-A-S-I-S, pityriasis. So this is what? A case of what? Pityriasis, which affect the scalp as a shiny asbestos-like thick scales. So your clue here that makes us pick this as pityriasis. Pityriasis is because of what? The asbestos-like scales. The asbestos-like scales that are found on the scalp. That are found. All right. And that's what we're looking at it as pityriasis. All right. So, yeah. However, I don't know why, however. So this should have been the right answer. And I don't think I'm even seeing the answer even in the question, isn't it? I'm not even seeing the answer in the question. Now, even this people can sometimes misdiagnose it as a psoriasis or even seborrheic dermatitis and even lichen planus. Lichen planus. People can misdiagnose it as some of these things. Now, over here, according to Krok, this is microsporia. And to be honest with you, I don't know why. This is microsporia. So please, if you know it, do well to let me know or just comment on it and then let us learn from you. But for me, this should have been what? Pityriasis. Pityriasis, that's the name. Pityriasis. All right, so this over here is what? Microsporia, but I don't know. So please feel free. Again, I stand to be corrected about my diagnosis, so feel free. But I would have gone for pityriasis because of the characteristic of the lesion, which is asbestos-like scales. All right. A woman complains of a frequent watery stool 9 to 10 times per day with mucus and blood admixtures, dull pain in the hypogastrium. Weight loss, guys, look, weight loss is there. 4 kg within the last year. Objectively, there's malnutrition, dry skin, low thigh, aphytos stomatitis. Abdomen is soft, sigmoid colon. Guys, look, the sigmoid colon is spastic and painful on palpation. Occult blood test is positive. Fibrocolonoscopy, there's edema, hyperemia, mucosal granulation, pseudopolyps, ulcers with irregular edges. Name your diagnosis. Name your diagnosis. And of course, I know many of you will be thinking of a differential in your mind, whether it is a shigellosis or it is what? Ulcerative what? Colitis. Ulcerative what? Colitis. And I believe we have distinguished between these two sort of diseases. We even went further to talk about irritable bowel syndrome and irritable bowel disease. By now, you should know the differences between these two things. And of course, the irritable bowel disease comprises of what? The colitis and the Crohn's disease. The Crohn's disease. So please take note of that. But again, like I said, do well to watch our videos. Like I've been preaching all this time. Do well to watch our videos on the basis. And I believe you will find, not I believe, it is there. You will find all of these explanations over there. So of course, over here, you are definitely looking at what? Irritable bowel, how do you call it? Non-specific ulcerative colitis. This is not a bowel syndrome, no. Because there is a problem in the intestine, isn't it? There is an organic damage in the intestine, isn't it? Yeah, there is. There is. So you don't go in for that one either. So over here, we're looking at what? Non-specific ulcerative colitis, which is actually a type of irritable bowel disease. It's a type of irritable bowel disease. All right. So let us continue. So this is what A. A 9-year-old boy fell off a tree and hit the back of his head. So from a tree, you hit the back of your head. So one of the things that, so this is the back, if it is the front of the person's body, you could be talking about the lungs, so the chest area. But since at the back, you'll be looking at perhaps the neck area, because that's one of the delicate places, because I told you guys that anytime there's a damage to the spinal cord, there could be a problem with respiration. So it is a place of, it's a place that we don't joke with. So we always have to make sure that the neck is okay. So let's continue. Now they said there's a brief loss of consciousness. Condition is satisfactory. Headache and vertigo is there. X-ray scan showed a depressed fracture of the occipital bone. So again, this is the head, isn't it? The back of the head. So the occiput area, you could be looking at it. The neck area, you could be looking at it. So since of course, since there's nothing relating to the neck, no problem with the neck, no problem with respiration whatsoever. But look at it. There's a fracture, a deep, depressed fracture of the occipital bone in the area of the external occipital protuberance. That is the occiput. What treatment tactics is indicated for this patient? Guys, this person has hit his head and there's even a fracture there. This is definitely requires a surgical intervention. And don't forget, you have to do your CT scan, head CT. You have to do your head CT as well. So definitely we are looking at what? At a surgical case. So over here, our answer would definitely be A, surgical intervention. That should be our tactics. Surgical intervention. All right. So we have what? A 16-year-old boy developed dizziness. His heart rate is 35 per minute. Blood pressure is 85/45. Heart borders are not enlarged. Heart sounds are loud and clear. ECG shows P waves that are disconnected from the QRS complex. You see, Q wave disconnected from the QRX. So then again, we have our ECG, isn't it? So this is your ECG, possible ECG anyways. And you notice your what? Your P wave, isn't it? QRS. Very good. Very good. And don't forget, so the question now is, so this is the conduction. But before the P wave was conducted, it came from what? From the SA node, isn't it? From the SA node. So when the SA node fires, the P wave will start what? Conducting, or the atrium will start conducting, producing a wave called the P wave. Now, when the conduction gets to what we call the AV, that's the atrioventricular node, it also generates impulses and fires, isn't it? So this AV, or the atrioventricular node, serve as a linkage between the P wave and the QRX complex, or the atrium and the ventricle. That is the connection. So if they are saying that there is no connection between this P wave and the QRS complex, what it means is that there is AV blockage, as simple as that. And of course, we have degrees, we have partial, we have complete. So complete is more or less like a complete AV block. That is no connection whatsoever, not even a slight impulse whatsoever, nothing at all. And that is what we could be having in this patient. So disconnected QRS complex, dissociation and different rhythm of the atrium and the ventricles. You see, this is beating differently. The atria are beating differently. The ventricles are also having their own dance, isn't it? Now, this presentation is most characteristics of what? Again, there's no connection between the P and the QRX complex. So definitely you are looking at what? At a complete AV blockage. That is why here your answer should be D, complete AV blockage. A 56-year-old woman has been working as a disinfector for 19 years. She complains of general weakness, nausea, bitter taste in her mouth, heavy sensation in her right subcostal area, and a rapid fatigability. Her body temperature is 37. Sclera are ecteric. The liver is enlarged. Total bilirubin is 40. What is the likely diagnosis? What is the likely diagnosis? So again, look at the beginning of the sentence. This person was working as a disinfector. Sorry, has been working. Now, anytime they bring your occupation in, it is not there to beautify the question. It is there for you or to direct your diagnosis. So every analysis is very, very important. So now she has been working for 19 good years as a disinfector. So definitely. And now there's a problem with the liver. Liver is enlarged and bilirubin level is 40. So definitely there's a problem with the liver as well, due to perhaps the kind of work she does. And that is why over here we are looking at what we call occupational toxic hepatitis. Occupational toxic hepatitis, which is simply an inflammation or the swelling of the liver that is caused by exposure to chemicals or drugs, or from drinking excessive amount of what? Alcohol. But this is not about alcohol, but definitely it is because of the exposure to the chemicals in the infecting equipment or whatever that they use, or the substance that they use to disinfect. And that's why over here we are looking at what? At a C as our likely diagnosis. So if you want to reduce this, what do? You definitely take the person out of the exposure. and of course, treat symptomatically. Perhaps the patient will get better. And again, let me just add this to it. After watching all these videos, do well to solve the questions on their website, medentweb.com. Do well to solve the questions. What we have done is that you can find all these questions there. You can practice the question to test if indeed you have understood all that we are talking about, or you have understood the explanation that we are giving you. So when you get there, you solve the question, and under every question, when you answer, the right explanation will come up to you. So all the noise I'm making here, which maybe you might be tired of hearing, I have summarized them into writing. Okay, they are all into writing, so you can easily understand things better from that angle. So watch video, solve questions, and even there's a Krok that is timed. So if it is 30 minutes or 1 hour that you have to use to solve the Krok, they will give you 1 minute to solve, 1 hour to solve the Krok, to test yourself again and to help you to be able to work with time, so that in the final exams, you wouldn't be found wanting. You wouldn't be found wanting. All right. So that's just by the way. So over here, our answer is occupational toxic hepatitis. A 45-year-old man underwent a cardiac surgery a week ago. So again, they've given you a history over here. So whatever you're going to look out for, you're going to be looking out for what? A possible complication that might have occurred due to the surgery that was done a week ago. Now, his general state has been deteriorating since then. So dyspnea at rest, retrosternal pain that irradiates to the to the neck, marked weakness. His body temperature is hectic. Cardiac borders are expanded. Apical beat is weakened. Auscultation detects, guys. This is where your clue is. With all of these things, they are telling you that there is a pericardial friction rub. Now, a pericardial friction rub, also known as the pericardial rub, is simply an audible medical sign that is used in the diagnosis of pericarditis. It is used in the diagnosis of pericarditis. Pericarditis. That's inflammation of the pericardium, as simple as that. And that can be so. One of the reasons that can happen is because of the surgery or the history of the surgery. So it can lead to infection. It can lead to every surgery can lead to infection, can lead to hemorrhage and stuff. But over here, we will be looking at infection. And again, look at the body temperature. This is hectic. The body temperature is hectic. Body temperature is hectic. And that's over here. Definitely, you are looking at acute pericarditis as the possible diagnosis. Acute pericarditis. So your answer here should be C. All right. So ladies and gentlemen, this brings us to the end of 2020 booklet, the end of it. So we are done with 2020, and I believe you have learned something. Please, if you enjoyed it, let me know in the comment section. Say something. But of course, our doors are always open for questions. So please do bring in your questions, and let's help you to answer them. And of course, add some contribute something, and then let's so the other can also learn from you as well. All right, so we will see you in another video. Bye.